ครับสวัสดีครับ and good morning and maybe good afternoon for another side of the globe. Today, I'm glad to be here to talk about the COVID-19 and to talk about the situation, the introduction to what is the COVID. After 3 years, we living with COVID, we fight the COVID. What is the new thing we know? What is the new strategy we use to fight? And what is the strategy in the future we will use to win this war? COVID-19 situation now, some people think we may win this war since last year, but after the decline of the Delta wave, we found the Omicron wave. We found that many vaccines decrease efficacy, but we have new way to fight it back by treat it early. But most of all, after we treat the patient, we found that we can decrease the mortality, but we found that for the survivor, in this time, 99-98% of the infected patient is the survivor. But what will occur in the future? We found that some of the people, they still have the symptom of mild symptoms of the COVID. This is called the long COVID syndrome. This kind of complication side effect will affect the health status of the many peoples. Most of the people who infected with COVID have some kind of the abnormal in their body function left, and this knowledge is very new. So today we will talk about it. The first slide, please show the slide. I will show you about the situation of the COVID. I use the example of the case in Thailand. In Thailand, you can see in the right pictures, you see the Delta wave rapidly come, rapidly gone, while Omicron come instead of. But we are not the plateau of the Omicron. We may have the uptrend. The one thing we found that even we have more cases, but the mortality is not much as the Delta wave. Omicron have its characteristic easy to infect, but it is low severity. So in the future, we may find many waves of COVID, but I think the complication, especially acute complication, mortality, severe case may be decreased because of the effect of the vaccine. Even effect of the vaccine decline, but we have new weapon to fight back. It is the antiviral. So we look about the vaccine perception, vaccine efficacy and side effect, and the rate of vaccination. In Thailand, rate of vaccination is in plateau. We are in the plateau of the 80% of population for many months. And now we will have the long festival, Songkran festival. We are afraid of how to cope with this situation because when the people gathering around, lots of people may spread the virus each other. So in this time, we have a time around 1 to 2 weeks before this festival. So the knowledge you will got from Dr. Kenny today about the role of immunity may help you and your family and your patient. You will understand how we can improve the immunity by the mechanism of the supplement that have the research back like Lentin Plus. So in the right picture, you see the graph of the death rate of the cases in Thailand. You see it is same to the world. We have the Delta wave rapidly come, rapidly gone, and we have seen the uptrend of Omicron. So when we talk about the infection, we know long time ago since we know the theories of the infection germ theory. For the infectious disease, there is three components: the pathogen or virus, host or patient, and environment. Host must be strong and nearly 100% to achieve herd immunity. the virus must be weakened strain, but it should decrease the virulence and the easier. Sometimes some virus they have the natural mutation to be the weakened strain, but the spreading the R naught is higher, like Omicron in this day. And for the environment, virus don't like the hot weather and the dry. So in this time, in summer, I think we may control the COVID situation in Thailand if we can make our patient immunity increase. And you have to think about social distance and ventilation. This is a key environmental factor. Are we nearly win the war with COVID? In my opinion, I said no, because we need more knowledge about pathophysiology and the pathophysiology of the long-term side effect. After we control the rate of infection, I bet we have a lot of jobs to do to deal with the long-term side effect. So what is the pathophysiology of COVID-19? Pick up the article from Medical Journal Science last month. In this issue, they have the articles about what is a COVID, what caused COVID, what is the mechanism of COVID. COVID-19, we can say that now it is the disease of the immunopathology. We got the virus infection. Usually our body should clear the virus. And when our body clear the virus by the immune system, we have innate immunity. We have specific immunity. Usually our immunity should work together in balance, not much inflammation, not more inflammation. In this situation, we can control, we can eliminate the virus. But for COVID-19, it is not. It has the special character to enter every cell, every organ in the body, not only the respiratory system. And after that, when it multiplies, it causes the severe inflammation. It induces the body to release a lot of cytokine. This storm of cytokine causes severe inflammation. Severe inflammation causes organ damage. So if we want to control COVID-19, the first step, you should not got the virus, okay, by the social distance, whatever. And the second, if the virus enter your body, you have to stop them from multiply in your cell. And then you have to do anyway to make your immunity work in balance in the moderate way, not so much. And you have to eliminate the virus as much as soon as possible, as quickly as possible. Because if you have virus in your body in longer time, it may cause some kind of the abnormally in your organ working. We call the long COVID syndrome. For the long COVID syndrome, we found that some patients, I have to say most of patients, have some little symptom. We call it long COVID syndrome, like we call the chronic fatigue syndrome. It is a term used by US CDC to describe the symptom that persist after patient recover from kind of infection. Then the chronic fatigue syndrome and the long COVID syndrome may be overlap, but for the chronic fatigue syndrome, usually the side effect, the symptom, usually it is like a kind of malaise, systemic, or feel lack of energy, like sometimes we call post-exertional malaise. But for COVID-19, long COVID syndrome, they involve some organ and they may cause the organ damage or like a disease of some organ, and it may turn to be the non-communicable disease. Post-COVID and long COVID syndrome will be the health problem in the group of NCD, like we have the problem of metabolic disease today. So we need to understand how our immunity responds to COVID-19. We know that sometimes our immune have low ability to control, while sometimes our immunity they causes a lot of inflammation and elimination the COVID virus. So what control this situation? Why some people have no cytokine storm? Why some people have cytokine storm in the second days of infection? The first, the genetic factor, and the second, it may come from the underlying health status of each patient. Now we know that COVID virus is a systemic disease. It may infect to any cell that have the ACE2 receptor. ACE2 receptor, we found a lot. It is abundant in respiratory system and maybe renal system, and it may distribute to cardiovascular system. So this system was involved by the COVID-19, depending on the degree of inflammation. Due to in respiratory system that is the most abundant of ACE2 receptor. So the lung, the tissue is the major organ to be damaged by the reaction from immunity to virus. And the right picture, we show the cell, immunity cell that respond to the process of the response to COVID infection. You may see the NK cell and a lot of cytokine. And you may see the role of T cell. So you may see some idea to control the disease, like to add antiviral or antiviral drug, antiviral agent or antibody to act as the first step to control the virus in cell. We need to control the virus not to multiply and not to distribute to other cells. Then we found that in many organs, we have the symptoms involved by COVID-19. Slide please. Okay. On the right picture, you see some people have severe COVID. Some people is asymptomatic, mild COVID, even they have the comorbid disease. We found that the factors like autoimmunity, like viral reservoir status or the viral remnant, it means that ability of our immune to clear the virus, because some people immunity is not full function. Now we can test, especially in Thailand, we can test both the innate immune like NK cell activity, and for the adaptive immunity, we can test for the CD4, CD8, CD3 T cell. Then the inflammation causes tissue damage and organ failure. You may see the green star mark on this biosis. Like I always said many times, COVID-19 is about immunity and inflammation. We found that the dysbiosis status came from the problems of the gut microbiome. Many data from the new study show that there is a link between the dysbiosis status. Now we found that some kind of strain of bacteria in our bowel may involve to severity after you got COVID infection. But the data is not, it is still in early phase, not turned to clinical phase. But the data in the animal, it shows that we may modify or we may protect the animal from infection or decrease the severity of infection by manage that gut microbiome to bring the dysbiosis come back to the normal gut microbiome. And we may found that some kind of supplement of the bacteria, the probiotic and prebiotic. They may involve in the decrease of severity after infection. Not only bowel, but we found that lung microbiome also take part in the in the severity of the disease. This data just published in within this year or last year. It is quite new, but a lot of data about role of microbiome published every week. Okay, so for the trend of COVID-19 in Omicron wave, I have to summarize something. The first, we know that COVID-19 is a hyperimmune response that causes inflammation, causes vital organ damage, especially respiratory organ, and causes the patient to die. The long-term effect also occur after we resolve from the acute infection. What we know from the research, Omicron is not like Delta. Delta is serious. Delta causes people, they have high mortality. Omicron is less mortality, but easier, very easy to spread. Even it is low virulent, but easier to infect it. So the accumulation number of the severe patient may rise to the same number. It is like for Delta. If million people infected by Delta COVID-19, around maybe 5 to maybe 10% of patients may die. But the infectivity is low because it causes the patient to have severe symptoms, so they lock themselves into in their home. They could not travel, different from Omicron because the symptom of Omicron is mild. So infected people can travel around. So they have a chance to spreading to the people who are immunocompromised, like people who have underlying disease, like the people who are at the old age and not complete the course of the vaccination. So in some country, they have the policy change, no lockdown, but to live with the COVID. What they do? The first, for the vaccine, they found that especially in US and in Europe, they found that vaccine decreased efficacy, and we try to develop the newer version of the vaccine. But the time to develop the new version of the vaccine and the clinical trial to check for the complication side effect of the vaccine take long time. So we have to to research and to register the newer and better drug to decrease to lower the decreased severity. This kind of drug you may have heard about two groups of drug. The first, anti-inflammation. In the first year of COVID-19, like 2019, you have heard about the role of steroid, but you also not know that steroid is like the two sides of sword. It acts as an immune suppression, and then the secondary infection, secondary bacterial infection, sepsis come after. We develop to the specific anti-inflammation pinpoint to some kind of cytokine that release from the reaction response to COVID, like anti-interleukin 6. And we also have the antiviral. In the early days, we fight with COVID. You may have heard about we try to repurpose many old drugs, whatever ivermectin, whatever anti-malaria, whatever anti-HIV drug. Now we found that the concept of HIV drug is very interesting. So we developed the idea of antiviral in HIV. For HIV disease, we use the antiviral now in the style of the cocktail. We combine many groups of drugs. But many years ago, because I finished training in medicine for more than 10 years, in that time, it is a very early day of the combination or the cocktail. we give the drug to treat HIV patient. Only one drug. We use the drug A. If drug A is resistant, we use drug B, drug C. But now we combine the drug A, B, C together. For the COVID antiviral, the concept come like we do with HIV. We start with the favipiravir, remdesivir. Now we have new kind, different mechanism of the very potential antiviral, anti-COVID, like monopiravir and boosted nirmatrelvir or Paxlovid. For monopiravir, its action is different. It is like the kind of nucleoside analog. It interferes with the viral. It makes the viral could not replicate, could not duplicate its genetic material. So if they cannot duplicate the genetic material, they cannot produce the new viral particle. For ritonavir boosted nirmatrelvir, nirmatrelvir is a kind of the like a protease inhibitor. Nirmatrelvir act like the protease inhibitor in HIV. Okay, we may let the viral duplicate their genetic material, but in the final stage, the viral has to assemble the viral protein, the viral genetic material. This kind of drug inhibit this process, so virus could not assemble. When virus could not assemble, they could not multiply, they could not spreading to other cell. This drug in the trade name Paxlovid is a combination of the drug. Ritonavir boosted mean that with ritonavir not the active drug. We usually this kind of drug we need the ritonavir to boost or make the level of the active drug, the nirmatrelvir in that level higher. So this is why we for this drug we have to take two pill combined. And from the latest research, it has a 80% efficacy. But unfortunately, Paxlovid have a very high drug interaction, especially in people with old age, with multiple underlying disease. They cannot use Paxlovid because they involved with the diabetic drug, anti-lipid drug, cardiovascular drug, anticoagulant drug, a lot. So if you have a chance to use the Paxlovid, you have to ask the patient for the underlying disease and avoid, and please check with pharmacist for the drug interaction. We have more antiviral in phase 3 trial, but not registered by FDA. After two drugs, monopiravir and Paxlovid, we have around 2 to 3 drugs as a pill. And for the injection, not only remdesivir, we have the newer antiviral drug. So antiviral drug that will launch a lot in the next month, next year, may be the game changer. We may got success to control the COVID-19 like the success of the avian influenza 2009 control. In that time, before we tried to use the Tamiflu, we lost a lot of patients' life. But when we have Tamiflu, all of you may have experience. If you have the influenza, you give Tamiflu. Tamiflu can make the symptom improve much better. So they can control the severity. Very few people die from avian influenza compared to 10 years ago. So in some time, in the next time, we may found the magic antiviral that can use to control the viral load in the body. But when the virus enter our body, it start to cause the inflammation because COVID-19 is the hyperinflammation disease causes from virus infection. So this inflammation still make an effect in your body after you clear the viral, but the inflammation from immunity persists. So we may decrease the acute problem, but for the long-term sequelae, we need to study. We need to find the knowledge. We need to find the way to cure. The way we will do will be shared in the next session today. So if the standard drug, FDA approved drug could not achieve this goal, like in cancer, my experience in cancer, we found that chemotherapy is not good for every people. Some patients die because of chemotherapy, then die from cancer itself because the narrow therapeutic windows of the drug itself. So we have to develop the targeted treatment. We have to develop immunotherapy. And the knowledge of immunotherapy is the knowledge of the cure of cancer that achieved the Nobel Prize very quickly. It may be the quickest research to got Nobel Prize in the history. And only 2 years after the Nobel Prize, we have more than 6 immunotherapy drugs. And concept of immunotherapy can dramatically change the fate of the unable to treat. I mean that yesterday unable to treat, but today we can control the symptom. We can extend life of the stage 4 cancer patient to more than 5 years. So today, if the standard treatment could not achieve our goal, we may use the alternative. We may integrate other kind of treatment like immune enhancer, like the immunotherapy. Dr. Kenny will talk about the role of immune enhancer because Dr. Kenny have long knowledge and working in the field of integrative oncology, especially to enhance the patient's immune to fight the cancer. Now we will enhance the patient's immune to decrease the risk to be infected, to minimize the symptom of long COVID. For the long COVID, the definition of long COVID in by Center of Disease Control USA, you can find in this slide. It is sometime in the early day, around 40 years ago, we thought it came from the brain dysfunction, from the disease, from the infection. That is why there was called the encephalomyelitis or chronic fatigue syndrome, because the feeling of malaise we thought it may involve to the brain. But for the study today, we found that usually I have to say, no chronic fatigue syndrome, no long COVID syndrome patient have the brain lesion. The problem is that if the brain has no lesion, why we have the syndrome like our brain dysfunction? This is the question. This is the quest we need to answer. But CDC, they summarize the group of patients who have this kind of symptom. The definition is when not back to usual health 14 to 21 days, 2 to 3 weeks after heal, after improve from infection. It means that, okay, if you are infected with COVID-19, you take a drug or not, or and complete isolation, and within 2 to 3 weeks, you feel like you still have the COVID infection. ATK is negative, PCR test is negative. We do the blood check, that is not abnormal. We do the brain check, it is not abnormal. So this kind of patient was interested by CDC, and CDC invests a lot to understand the long-term effect of COVID-19. I will show you some of their early published data. They study the symptom duration and the risk factors of the delay return to usual health, delay to return to usual health within 2 to 3 weeks. It is called long COVID. This study done in the 2020. They found that many factors increase the risk to have this long COVID syndrome. The major involvement is obesity, immunosuppressive condition, chronic kidney disease, and some psychiatric condition. Because I read a lot of paper and they found that psychiatric condition relate to long COVID syndrome. Maybe the inflammation may causes the function of the brain change but not change in the brain structure. So in this group of patients should be involved in the risk group to be to close monitor and to find the way to treat, because for psychiatric patients sometimes they take like an antidepressant drug, antipsychotic drug. This group of drug has a lot of drug reaction, so the treatment is limited. From this study, we found that 30 to 40%, nearly half or one third of the infected people cannot return to work in 3 weeks. I may say that 1/3 of the patient infected by SARS-CoV-2 or COVID-19 has long COVID syndrome. Female are more affected. Older patients, especially more than 50 years, who have underlying disease and their immunosuppressive status, and if someone have more than one medical condition, they have more risk. The data on the cancer are very limited, because cancer sometimes we may call cancer is the disease of the genetic and also the disease of the immunity itself. The immune status also affected by some disease like diabetes. So if some people who have diabetes and infected with the COVID-19, we should monitor closely after their symptoms resolve. And we found the role of the innate immunity, an emerging field of the study, especially the dendritic cell and NK cell. And also the inflammation role that linked to ICD, and inflammation also linked to immune status. Both of these factors linked to severity of the COVID-19. And not to forget about the dysbiosis. US CDC summarized the post-COVID syndrome by the presentation. What is long COVID? Presentation. Okay, you can see in the picture. You can see in the website of CDC, they show the way to manage some symptoms. We show you in this slide is the post-exertional malaise. People with long COVID syndrome, they always say that they feel like they exercise for a long time, but they stay on bed. They feel malaise, but they can do nothing. This is the special characters of this syndrome. And some people, they may have problem of pain, memory loss, and sleep problem. This is causes the work ability decrease, and it causes decrease the productivity of all society in future. So today we will talk about the role of functional food, the role of immune enhancer, because to this day we have no special drug. In my meaning is the FDA approved drug. So we may use the knowledge to integrate the herbs, active ingredient, phytopharmaceutical, and many to cope with this problem. And we will break for 5 minutes, and then Dr. Kenny will talk about the control of infection in the post-COVID era part 1 and we have a little break and then part 2. After that, I will summarize for what we will do to cope with this problem and then the selective question and answer. For question and answer, you can send the question and answer to our team, whatever via line or via online channel. And we have a time around 20 minutes to answer the question. The rest of the question we will answer in after we complete this section. We have 3 days today, 4 days to stay together.